Cerebral palsy affects quite a lot of children, up to 4 children that are born per 1,000 live births. This is very common, and unfortunately, this has always been the case. The good thing is this has improved in the last few decades. Cerebral palsy, when it happens, it usually happens in the most classical scenario at birth, and this is non-progressive, which means it doesn't get worse throughout time. However, the implications on their bodies, on their muscles, and on their bone development does get potentially worse as they grow up. In cerebral palsy, the stimuli that come through the neurons, the nerve cells, down to the muscles, and hence create motion of their bones, can be affected. The tone, which is the intensity of the muscle, can be increased because of the increased signals coming from the brain. And the tone in itself, because the muscle doesn't relax, the tone can affect the ultimate function of the muscle, can lead to contractures and ultimately deformities that us as clinicians need to help with, either neurology, a physiotherapist, or ultimately as an orthopedic surgeon. If you see your infant child or toddler baby that they're slightly behind when it comes to interacting with you as a parent, they're slightly behind when it comes to turning over or standing and walking, which sometimes can, in a normal variant, can be up to 18 months. If you notice all of these signs or one of them, please ask your general practitioner for advice or health visitor for advice as to the potential cause of this. The diagnosis of a cerebral palsy patient is a multidisciplinary team approach. Sometimes, and most of the times, it is either the general practitioner who notices this. The general practitioner then refers the patient to a pediatrician, and the pediatricians normally have the expertise to diagnose cerebral palsy or to suspect it, and hence afterwards refer to a specialist referral center similar to where I work, where pediatric neurologists who have extensive experience in diagnosing cerebral palsy will see the child and further make plans for the future. I think in order to quantify how much this affects the quality of life of children with cerebral palsy, I think we would need to look at the gross motor function classification system, the GMFCS, which you, as a patient with cerebral palsy, might have come across. Children are affected from 1 to 5 when 1 is very little involvement, and 5 is severe involvement. So we would need to employ the means of this classification system to know how much the child will be affected in terms of their function, integration, and general life. I think what would be really important is to have a very well-established set of goals in the first meeting, and to have a multidisciplinary approach to the management of this child, which involves school physiotherapists, home physiotherapy, occupational therapy, and ultimately pediatric support when needed. And only when the last resort comes in, that's when the pediatric orthopedic surgeon with cerebral palsy expertise comes in. Cerebral palsy, in many of the cases, especially in the less severe cases, is a condition that the child can live normally, can function well, can have no issues in terms of their life expectancy, and they will normally integrate quite well. In the extremely severe cases, that can be sometimes affected because of other issues that can be present simultaneously, such as breathing conditions, but this is in extreme situations only, and this should not be the first thing that the parent thinks of.